There's a freeze on Medicaid payments that is forcing cuts to rural health care. The clinics in rural areas of the United States represents lifelines for thousands of people who live hours away from major hospitals. When funding disappears, it's not just services that vanish. It's the only place some patients have to turn to for cancer screening, diabetes care, or even basic physicals. This story underscores how precarious rural health care really is, and how one policy change can ripple through entire communities. The Trump administration has cut off funding for certain providers around the country whose offerings include abortion. Patients in the state of Maine are among those who feel the fallout. This is their story. Welcome to That's Life, I Swear. This podcast is about life's happenings in this world that conjure up such words as intriguing, frightening, life-changing, inspiring, and more. I'm Rick Barron, your host. That said, here's the rest of this story. On the far edge of Maine's rocky coastline, in a small clinic surrounded by pine trees and quiet harbors, a woman received devastating news. The cancer she had once fought so bravely had returned. In another place, the delay for such a diagnosis might have stretched for months, but at this modest family planning clinic, the staff acted swiftly, performing a biopsy that confirmed what the patient had feared most. Within a week, the woman was sitting in a specialist office in Portland, a life potentially saved by a timely diagnosis. This is what life-saving care really looks like, as one nurse at a family clinic said, knowing that her ability to provide such care is in danger. The clinic is part of Maine Family Planning, a small but vital network of 19 health centers scattered across some of the most rural corners of the state of Maine. For thousands of Mainers, these clinics are not just one option among many. They are the only place where consistent medical help is within reach. Yet the very existence of these clinics is now under serious threat. In July of 2025, the federal government, under the direction from the Trump administration, stopped Medicaid payments to reproductive health care providers that both offered abortion services and received substantial Medicaid funding. The decision was framed by supporters as a matter of protecting taxpayer dollars, placed an enormous strain on the fragile infrastructure of rural health care. Although the policy was widely viewed as targeting Planned Parenthood, two smaller organizations, Maine Family Planning and Health Imperatives of Massachusetts, were collateral casualties. Together, they served tens of thousands of patients who relied on Medicaid for basic medical needs. For Maine Family Planning, the financial blow has been devastating. The organization had been losing roughly $165,000 a month since the funding freeze took effect. Its attempts to challenge the decision in court failed, and the network now faces an impossible choice: to continue running at a loss or to begin shutting down essential services. On October 31st, 2025, the Maine Family Planning was forced to discontinue its primary care services, a decision that rippled across entire communities already struggling with physician shortages and hospital closures. This is not a theoretical loss, said Olivia Pennington, the group's advocacy director. We're talking about people who will have to drive hours for a doctor's visit or go without treatment entirely. We're talking about preventable illnesses that will go untreated. The state of Maine has a long geography, with its long stretches of forests and farmland punctuated by small towns, means that access to health care is always fragile. For many residents, the local family planning clinic doubled as their only consistent source of medical attention. Patients came in for birth control or cancer screenings. Still, they ended up receiving far more: treatment for diabetes, blood pressure management, asthma medication refills, and even basic physical exams required for work. About 30,000 patients across Maine depend directly or indirectly on this network. More than 2/3 of them qualified for free or reduced cost care based on income, and Medicaid covered half. Now, these were not luxuries. They were the most fundamental of services for people who lived paycheck to paycheck, often too far from the nearest hospital to make emergency care a realistic option. Yet because abortion services were provided at a handful of these locations, the entire organization became a political target. Now, the irony was not lost on the healthcare workers. Federal law already disallowed Medicaid from paying for abortions in all cases. The Medicaid funding in question has always gone toward non-abortion services, the kind that keep people alive and out of emergency rooms. If the funding cutoff becomes permanent, and many clinics fear that they will, the impact will be catastrophic. Maine Family Planning's president, George Hill, said that the network budget relied heavily on a combination of Medicaid and Title X funding, which together made up about 40% of its income. State aid covered only about 10%. Without replacement funds, he warns, clinic closures will follow. Unlike wealthier states or large urban centers, Maine doesn't have a deep donor base to lean on. I mean, let's be real. They're not New York. Maine doesn't have millions in private philanthropy waiting in the wings to keep them afloat. Now, the threat goes far beyond Maine. Planned Parenthood warned that 200 of its 600 clinics nationwide could be forced to shut down due to similar funding losses. The closures would disproportionately hit low-income and rural communities where medical deserts are already forming. In some Republican-led states, the effects are already visible. Planned Parenthood shut down its last remaining clinics in Louisiana and several in Ohio, citing both state-level abortion bans and the federal funding cuts. Meanwhile, Democratic-lead states like California, Oregon, Washington, and Hawaii are racing to fill the funding gap through emergency appropriations and private donations. The governor of the state of Washington pledged $11 million in state fund support to offset the federal cuts, but even that measure faces uncertainty amid budget shortfalls. Now, states are not going to see federal attacks lessen. If anything, they're going to intensify. In Maine, the divide between urban and rural health care is very stark. In the southern cities, hospital systems and private clinics offer a range of specialized care, but travel north towards Aroostook County, where the forests stretch endlessly towards Canada, and the medical landscape changes dramatically. There, Maine Family Planning's small outposts are often the only healthcare available for dozens of miles in any direction. In Maine, access to healthcare varies widely between the state's most populous southern cities and its vast northern reaches. Rural residents have poorer health overall and are less likely to have insurance. Two of the clinics most affected by the Medicaid cutoff are in Aroostook County, one of the most medically underserved regions in New England. The area covers about 6,800 square miles, roughly the size of Rhode Island and Connecticut combined, but lacks even basic access to primary care in many towns. In Ellsworth, clinic staff work closely with the local homeless shelter to provide mental health counseling and medical care for unhoused residents. In Thomaston, a medical team was preparing to launch a substance use treatment program, a lifeline for residents battling addiction in a region plagued by opiate use. That initiative is now indefinitely on hold. The people in Maine are simple. They are hauling lobster traps, fixing roofs, caring for other people's summer homes. They are working hard, and yet they are being punished by a political system that had nothing to do with them. Now picture this if you will. A van parked near a bridge overlooking the Connecticut River. It looks normal from the outside, but inside is a miniature medical lab, the newest addition to the Maine Family Planning Network. The mobile clinic, staffed by a nurse practitioner and EMT, became a traveling lifeline for people who had fallen through the cracks. The EMT remembered spending an hour and a half persuading a man with a badly infected leg to accept treatment, slowly earning his trust. Over the past year, the team's steady presence began to stabilize the health of their patients, many of whom live in tents or shelters nearby. When the program started, it felt like every case was in constant crisis mode. Today, the number of emergencies is lower because consistent care is being provided. That's what makes a difference. Consistency. Even this small victory is precarious. The healthcare system in Maine is so fragile, and this is just the state of Maine. Think of the other states. Maine's overall healthcare system is already under intense stress. Early in 2025, Northern Light Health, one of the state's largest providers, shut down a hospital in Waterville and a clinic in Bangor, eliminating 300 jobs. A bitter contract dispute in 2026 with one of the state's major insurers now threatens to push 30,000 patients out of the network. For residents in remote towns, it could mean starting over with entirely new doctors, if they can find any. For people like Ashley Smith, who works in the restaurant industry and pays for her care out of her own pocket, the Maine Family Planning Clinic had been a lifeline. The clinic treated her for a rare condition and provided the physical exam she needed to start a new job. She said, and I quote, "They gave me peace of mind. I don't know where I'll be without them." End quote. At the Hellsworth Clinic, longtime nurse Bethany Jarvis has spent decades caring for the same families, which are sometimes 3 generations of them. Now she's facing the agonizing task of preparing her patients for what comes next. And she said, and I quote, "I haven't even started those conversations yet. It's too painful. These people trust us. They've built their health around this place." End quote. What's happening in Maine is not an isolated incident. It's a warning about the fragility of rural healthcare systems that depend on small mission-driven clinics to fill enormous gaps. When political decisions ripple through this delicate network, the consequences land squarely on the shoulders of working families, the elderly, and the medically vulnerable. Behind every statistic is a person like the woman on the coast whose cancer was caught in time, because there was a clinic nearby that cared enough and could afford to see her. What happens when that clinic is gone? For now, Maine Family Planning continues to fight in courtrooms, in the State House, and in the hearts of the patients who depend on it. But unless funding is restored or new lifelines appear, the state's most rural communities may soon find themselves facing a grim reality: that in the battle over reproductive rights, their access to basic health care itself has become collateral damage. Now, the story I've shared with you is just for the state of Maine. As of this recording, 759 rural U.S. hospitals are at the risk of closure due to financial problems, with about 40% of those hospitals at immediate risk. The counts are drawn from the Center for Healthcare Quality and Payment Reform's most recent analysis. The study identifies 2 distinct tiers of rural hospital vulnerability: those at risk of closure and those facing immediate risk of closure. Stay tuned. Well, what can we learn from the story? What's the takeaway? Healthcare access shouldn't depend on your zip code, your income, or the politics of your state. This is a reminder that when ideology drives health policy, it's everyday people, not politicians, who pay the ultimate price. Well, there you go, my friends. That's life, I swear. For further information regarding the material covered in this episode, I invite you to visit my website, which can be found on Apple Podcasts for show notes and the episode transcript. As always, I thank you for the privilege of you listening and your interest. Be sure to subscribe here or wherever you listen to podcasts so you don't miss an episode. And we'll see you soon.